Oh, hi there. How are you today? Oh, take a seat. I can see your eyes are looking really red and sore, aren't they? Okay, we'll just take a seat a second. I'll just check your notes. Our computer systems aren't working properly today, so we managed to print off some of your recent notes, and I'll just check through those, make sure I've got the correct details, if that's okay. Okay. So just confirm your name for me. All right, that's great. And date of birth. Okay, that's fine. I think before we go any further, there we go. I think you need a tissue for your eyes, don't you? There we go. Good. There's plenty more if you want some more. Okay. And your current contact number? Yeah, that's fine. Okay, let me just have a little look through here. Okay. Okay, so we've not seen you for a little while, have we? Okay, which is always a good thing if you've been feeling fine. Okay, so I'm guessing that you're visiting me today because of your eyes and nose, I'm guessing, because you sound quite snuffly. Yeah, okay. So what's been going on with those? Okay, so your eyes are itchy. Okay, and very watery. Okay, and they feel sore too. Okay, do they feel like there's grit in them? No, itchy. Okay, so this is gritty and itchy. Yeah, that's fine. Okay, with your nose, are you sneezing? Yeah, okay. And your nose is quite runny at the same time. Yeah, okay. How's your throat feeling? Scratchy. Okay, not scratchy. Okay, any cough? All right. That kind of tickly cough may just be due to mucus from the nose in the back of the throat, okay? This is all leaning towards you having an allergy, and given the time of year, it certainly looks and sounds like you have hay fever. Have you had hay fever in the past? Okay, so it was childhood, but then it cleared up. Okay, what age did that clear? Okay, so we're about 18, and this is your first episode since. Okay, all right, okay, and your current age is 34. All right. Okay, have you got any ear pain at all? No, but your ears feel a little bit itchy. Yeah. Okay. Alrighty. Well, I think we just need to have a closer look in those eyes, don't we? And have a little look in your throat. Okay, have a feel around. I'll check your blood pressure while you're here as well. Yeah. Okay. You've been getting headaches too, okay. Do you feel congested? Yeah. Okay, well that'll be due to the congestion there with the allergies, I'm sure. It can be treated. It can be treated in a number of ways. So we'll have a look and we'll see what's going to be best for you. Okay? All right, well, let me check your blood pressure first. Okay, so I'll just be putting the cuff on your arms. I'll do each arm and inflating the cuff, okay? All right, you've had it done many times, yeah, so you know what to expect. Okay, so let's get the cuff on your left arm. Okay, outstretch that arm nicely for me there. That's great. Okay, all right. Okay, just place my stethoscope on your arm there, and I'll inflate the cuff. Okay, that's good. Let's remove that. Okay. And let's move over to your right arm and we'll check that one. Okay. Outstretch your arm for me. Thank you. Go and round. Okay. Just place my stethoscope on your arm again and we'll inflate the cuff. Super. Well, your blood pressure is 122/83, and that's perfectly healthy. So that's what we like to see. Okay. So, I'm going to get some gloves on and I'll have a look around your eyes. In your eyes with the light. I'll have a little look at your nose and in your throat as well. Okay. We always want the nice weather, don't we? And then when it arrives, it brings all these allergies with it. So I'm just going to put my gloves on. Got some nice new comfy gloves now. These are great. Everybody was complaining about the last ones. Okay. So, I'm just going to have a little look in your eye at first without a light, just a little visual check. So just look straight ahead at me if that's okay. Thank you. I'm just going to pull the eye down there. Okay. Alright, and let's have a look at this side. Yeah, they're slightly puffy underneath, aren't they, as well? Okay, yeah, there's a lot of redness in there, which is not very visible anyway, but they're very, very irritated. But I did notice when you were sitting here at first you were rubbing your eyes, please don't rub them. I know it's really difficult because they're so irritated, but by rubbing them you actually only make things feel worse, and the redness can get worse, and you run the risk of getting infection in your eyes as well if you put in your hands by your eyes, particularly when they're already irritated. So once they're starting to feel better, when we've given you some medication for them, you will have less urge to rub them. Okay, but it's good to bathe them as well. Just bathe them in some cool water, and that will make them feel a lot better as well, rather than you rubbing away at them there. Okay, so if you just look straight ahead for me, I'm just going to have a look into each eye with this light. Okay, alrighty, and okay. Keep looking at my nose, thank you. That's not hurting your eyes, is it at all? No. Okay. Alright. Okay, and let's try this side. I'm just looking in that left eye. This one looks particularly sore. Yeah. Okay. Right. Okay. I'll get you a tissue there because they're a bit watery on, and let's just give those a gentle dab underneath. And don't rub your eyes with tissues either, just give them a little dab, just like I have there. Dab, 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 dab. Dab, 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 dab. Okay. Alright. So I just want to have a look in your throat. I'm happy that this is an allergy as opposed to anything else, because it doesn't feel like a cold, does it to you? No, you haven't got those other symptoms. So okay, let's have a look. Put my light on again, and I'm just going to depress the tongue slightly, open nice and wide for me. Okay, there we go. And I'm just going to have a look in your throat. Can you say "ah" for me? Okay, and again. Okay. Okay, just going to move that a little bit there. Okay, and just to be sure, just say "ah" to me one more time. Okay, great. Okay. Okay, good. I'll just write a few notes there. So I can't see any real irritation in the throat. The itchiness will be from that mucus, which tends to make it quite tickly. The prickly sensations arise from the allergy as well. Okay. And I'll have a little listen to your chest, if that's okay. Okay, so just okay just to undo your shirt a little bit there for me. That's great, thank you. You okay there? Good. Okay, so I'm just going to have a little listen there. Okay, can you just take a nice deep breath in for me? Okay, and out. Okay, and again for me. Good, and again. And one more time. And can you give me a little cough, type of cough, okay? And round the back, cough again for me, okay? And another deep breath. Lovely. On this side, okay, little cough. And a deep breath. Okay, and breathe normally for me. Okay. That's good, okay. Thank you. Okay. Your chest actually sounds clear. So that confirms that the cough really is just isolated to the upper respiratory there, where it's just all tickly in the back of your throat, okay? Good. Okay. I don't expect there to be any problems with your lymph nodes relating to this, but I will just check them while I've got you here, because it has been a while since you've been to see me, hasn't it? Yeah. Okay. So I'm just going to check the nodes in your neck first, okay? Great. Just relax for me, okay? Right. Okay. And just across your shoulders there. Okay. It's right just under the jaw. That's all fine. That's super. Okay. I just want to have a little look up your nose with the otoscope. Okay, so just be shining this little light just up your nose. Have a little look to make sure there's no real redness, okay? Alright. Can you just tilt your head back for me? Okay. Okay, and this side. That's great, okay. And I'll have a little look just in your ears. Okay. Just going to pop the otoscope into your ear, okay? And pull the ear back. Ear's good. There's no redness or swelling in your right ear, so that's good. I'll just have a look on the other side. Okay. So let's just put that there and insert that into the ear. That's good. You got no pain there when I did that? No, okay. I'll just have a little press around the outer part of your ear just to make sure. Okay, so just, there we go. Okay, and this side. There's no pain or tenderness, no. Okay. Okay. Let's just give those eyes a little dab again. Okay. I've got actually, I've got some drops which I'm going to prescribe for you for your eyes. But you're the 4th patient I've had in today with hay fever symptoms. So I'll pop a couple of these drops in because this will make them feel a lot less irritated very quickly. Okay. Okay, let's pull your eye down and you look up for me. Alright. Okay, there we go. There we go. And one more. Yeah, great. Let's do the other eye. Okay, again, I'll pull your eye down and you look up. Okay, look up for me. There we go. Great. Okay. All right. Let's have a look around those now. I'd like to see a reduction in the swelling there soon. I think we'll get that once we start you on the proper medication. That puffiness will calm down. Okay. All right. Just remove my gloves. How are those eyes feeling? Good. So have you not taken any antihistamines or anything? No, okay. You were waiting to see what I said. That's good. Well, I'm going to prescribe you antihistamines. I think that... Are you still working? Okay, so I'm not going to prescribe you one of the sedating ones, which are more effective. But if you need to be at work or driving or, operating any machinery, equipment, then sometimes the first generation of antihistamines, they are quite sedating, although, as I said, they are the most effective. So I'll prescribe you something that isn't going to make you drowsy. Okay. All right. Just find my prescription pad underneath everything else. Okay. So we'll do. Let's have a look. Okay. Those. Okay. And you can take these 3 times a day. Okay. So that's that first one. And secondly, I'm going to prescribe you a nasal spray. Okay. Now the nasal spray, it won't work straight away. It might take a week or so to start taking effect, but it actually helps with a lot of those symptoms. Okay, so I'll do that. But you'll only need to use that once a day. Okay. And then the eye drops. 3 times a day on the eye drops. Okay, let's just sign that. Okay. Seems a little strange writing prescriptions because we normally print them out, but as I say, everything seems to not want to work today. So, okay, so there's your prescription. Great, okay. Can you see okay now? Your eyes cleared after those drops? Good, all right. If you've had no improvement after a couple of weeks, then do come back, but I'm quite convinced that you are suffering with the seasonal hay fever allergy. The grass pollens are very high at the moment, so you've probably got another several weeks of the pollens being high, but obviously they can fluctuate with the weather, so you might have days that you feel better than others anyway. But you're fine to take all this throughout the hay fever allergy season. Okay. Well, take care, and I hope you're feeling much better soon. And come back and see us if you're not. All right then. Take care. Have a good day. Bye-bye.